Good morning, folks.
Hi, Kathy.
Good morning.
Good morning. We'll keep giving folks a few more minutes to join. Welcome, folks. We're going to give folks another couple minutes to join. Welcome all. We're giving folks about one more minute to join. Welcome, folks. We'll get started in about 30 seconds. Okay, let's go ahead and get started with our introductions. And we probably will still have some folks joining, but I think we have a lot of folks now. So for those who don't know me, my name is Kathy Kilring Del Rio. I use she, her pronouns. I'm with Maine Equal Justice, and I'm the chair of the MaineCare Advisory Committee, the MAC. And for introductions, we usually go through the list that I have of MAC members and sometimes alternates, and then give space for MaineCare folks to introduce themselves, another chance for anyone who's a MAC member or alternate, and then guests. And again, if you can remember to introduce yourself with your names, your pronouns, and if you're here for an organization, if you can say that as well. And let's get started with Esther Miller.
Good morning, Esther Miller, MaineCare Program Manager with the Office for Family Independence. OFI manages eligibility for MaineCare.
Laura Cordes,
Good morning, Laura Cordes, she, her, hers. I'm the Executive Director with MAXPE, the Maine Association for Community Service Providers.
Jamie Cotmore, Kathy Dion,
Good morning, Kathy Dion, Executive Director for the Autism Society of Maine, and I use she, her, hers.
Gia Drew,
Good morning, Gia Drew, she, her, Executive Director at Equality Maine.
sorry, I didn't unmute myself, Rachel Dyer, I know Leo can't be with us today, Mark Eves,
Yes, good morning, Kathy. Mark Eves, Executive Director of Woodford's Family Services, he, him pronouns.
Mike Hollenbeck, Kathy Henderly, excuse me, Candy Henderly,
Good morning, Candy Henderly, she, her, hers. I am the Director of Health for the Penobscot Nation.
thank you, Jillian Joliker,
Jillian Joliker, she, her, hers, Assistant Slash.
Beth Pierce,
Beth Pierce, Oral Health Program Manager, she, her, hers. I'm with the Maine Primary Care Association, supporting all of the federally qualified health centers in Maine.
Sarah Lewis, Jim Martin, Vicki McCarty, Sarah Squires,
Sarah Squires, she, her pronouns. I'm the Public Policy Director for Disability Rights Maine.
Dee Sabatis, Rachel Collmore,
Good morning, Rachel Collmore, Consumer Assistance Program Manager at Consumers for Affordable Healthcare.
Suzanne Farley,
Good morning, I'm Suzanne Farley. I'm the Executive Director of Wellspring.
Jeff Tyner, Susan White, or Lori Belden.
Good morning, everybody. She, her, hers. I'm Lori Belden. I'm the Executive Director of the Home Care and Hospice Alliance of Maine.
David Winslow,
Good morning, David Winslow with the Maine Hospital Association.
any MAC members or alternates who I missed?
Hi, this is Mallory Shaughnessy, Executive Director with the Alliance for Addiction and Mental Health Services, and I use she, her. I'm also the Vice Chair, I think, now.
Yes, thanks, Mallory.
Hi, this is Nancy Cronin. I am the Executive Director of the Maine Developmental Disabilities Council, and I'm here for Rachel Dyer.
Thank you.
This is Al Bergen with Spurwink, he, him, his.
I'm Piper Stiles. I'm the MaineCare, federally mandated MaineCare recipient member on the MAC committee.
Welcome, Piper, to your first meeting.
It's my third.
Oh, I haven't seen you here before. Thank you so much.
It's her second official MAC meeting, and she also joined a subcommittee meeting. So it's her third. She's been Piper's been jumping right in.
Well, thank you, Piper. I'm not surprised to hear that. Let's pass it over to MaineCare, and then we'll come back in case we missed any other MAC members and other guests. I believe I saw Michelle.
Yes, and there's a few of us in person today. So the weird thing is that where you see the room and it says Jennifer Patterson, that's going to light up when 4 of us who are in the room talk. So apologies for the Zoom scrolling that might entail. But good morning, everyone. My name is Michelle Probert. I use she, her pronouns, and I am the director for MaineCare, and we can go around the circle in the room. Jenny.
Hi, everyone. I am Jenny Patterson. I am the Director of Policy for the Office of MaineCare Services, and I will pass it to Molly.
Hi, good morning, everyone. Molly Slossman, Chief Operating Officer for MaineCare. Mandy.
Hi, Amanda Lee, rate setting coordinator. I use she, her pronouns and trying to get connected, sorry.
And let's go to Lisa next.
Good morning, Lisa Weaver with the Office of MaineCare Services, she, her, hers, and I think Eric is up.
Hello, my name is Eric Isley. My pronouns are he, him, and his. I'm the Director of Communication and Planning for MaineCare, and I did a quick scroll through and didn't notice anyone else. Am I missing somebody? I think that's it for MaineCare, Kathy.
Thank you. Any other MAC members or alternates who got missed?
I'm late, Sarah Lewis with Maine Access Immigrant Networks. My pronouns are she, her. Thanks.
Thanks. Okay, any other guests who would like to introduce themselves? You can either take yourself off mute and do that, or you can put it in the chat.
I'll unmute myself. I'm a guest. This is my first meeting, Eric, and I chatted about it, but I'm Susan Sheff. I'm a family physician. I'm the Executive Clinical Director for Integrated Primary Care Services for Penobscot Community Healthcare.
Well,
thank you.
Okay, I see lots of folks introducing themselves in the chat, which is great. Welcome, everyone. I'll try to keep my eyes open in case we have any other MAC members join late so they get captured for the attendance. And let's go ahead and jump into our agenda. So I'll pass it back to you, Michelle, for updates from MaineCare.
Great. And Mandy might sit next to me because her internet is not working. Internet is less likely to work when you're in the state office building, which is really interesting. So good morning again. And I started to write in the chat, but I will just say a special welcome to Susan as well as to Piper. Eric Isley will be talking more about updates to MAC representation, but I'll just say that it's really exciting to see Piper, a member representative on the MAC again, and Susan, a clinician representative as well. So we are excited to be continuing the transition to having a more member-centered MAC group as a whole. But I won't steal any more thunder from Eric and just wanted to say a warm welcome. All right, so especially for those who are new, when I go through some of our general MaineCare updates, I am not going to be talking about reimbursement rate updates because that has its own separate section on the agenda, and likewise, our general policy updates also have a separate, their own bullet on the agenda, and Jenny Patterson will talk about that further along. So first update, and I'll try to be good about giving a little bit more context for those who haven't heard this before. From the federal government's perspective, we are still technically in a public health emergency, and that is important from a Medicaid perspective because during this public health emergency, which has been in effect since March 2020, individuals who otherwise would have lost their Medicaid coverage because of changes to income or household size, et cetera, have been able to maintain that coverage during the public health emergency. As a result, in Maine and across the country, many more people continue to have Medicaid coverage who otherwise would not have it right now if it were not for the status of the public health emergency. The public health emergency, per federal law, lasts for 90 days, and then it gets extended. And I think it's been extended something like 12 or 13 times now, which is makes you realize that the pandemic has been going on for a while. But the frustrating piece is that there's always this uncertainty of when is it going to end. And our last MAC meeting that we had, we were waiting with bated breath because the federal government has promised 60 days notice to states before 60 days notice if the PHE, the public health emergency, is going to end. So the official next end of the PHE, absent an extension, is January 11th. So 60 days prior to that, November 11th, there was no announcement about the PHE ending. And so what that means, at least what this has meant every single other time we've gone through it, is that we can expect the public health emergency to be extended past January 11th for another 90 days, which would bring us to April 11th. There is, at least theoretically, the chance that with a new Congress, they could choose to make changes in terms of how long the PHE gets extended for, or right now, CMS has issued guidance long ago now that says once the PHE does end, states have 1 year to go through the process of checking eligibility for every single Medicaid member and disenrolling individuals who are no longer eligible. So I'm not too worried about this, but just so people know, with a new Congress, there could theoretically be different actions on this front, even though we have not received an indication of that, and no one has said that the current plan is going to change. So at the moment, we are expecting that the PHE will extend into April, which gives us flexibility to get authority to do different things from a MaineCare policy perspective and coverage perspective. And that also means that individuals will continue to maintain their coverage status with MaineCare, even if they're not eligible. And what we are really asking of folks currently is to please spread the word early and often to MaineCare members to make sure that their contact information is up to date. And Eric can share our PHE website in the chat, which has clear instructions on how to update addresses either by phone or online, as well as other resources that we have regarding the eventual end of the public health emergency. That was a little bit longer of an update than usual, but since we have new folks who have not had the pleasure of having this conversation all the time for the past year, I just wanted to give a little bit more of an update on the public health emergency. Next, I will actually take the opportunity to brag for the Office of MaineCare Services a little bit. In November, we attended the national, or some of us attended the National Association of Medicaid Directors meeting, and that association selected Maine as one of 3 states to receive what they call a Spotlight Award for the year. They highlighted states that had implemented innovative practices that they felt would have positive impacts from a health equity standpoint, and that could also serve as examples for other states. And we were selected as an award recipient for the work that we have done in conjunction with many of you around what is now Chapter 639 and our general rate reform efforts to make sure that we have a process and principles by which to ensure that rates are adequate and equitable and data driven, and that they remain sustainable over time. So that was, that felt great. And thank you all for your contributions to that effort as well. All right. I should always take the opportunity to say to folks that if you're not signed up for our e-message system, please do so. A lot of my updates actually come from running through those to see what has happened over the past month, and it's a good source of information. So I did want to note that we implemented, we started engaging with stakeholders around our intent to expand what is currently the opioid health code model to a model that can assist individuals with other substance use disorders other than opioid use disorder as well. And so there was a session on 11/16, and thanks for folks who participated in that. And really, if you don't have an opioid use disorder right now, your opportunity to receive case management or care coordination services through MaineCare is very limited. Our targeted case management for substance use disorder is really, I don't know the specific criteria, but it's IV drug use if you're pregnant. And so there are not a lot of instances where people with other SUDs can get those services. And we're excited to utilize a health code model to start moving in that direction. So you'll be hearing more on that in the future. I also wanted to give the update. As we talked about before, we reopened our PC Plus application. That primary care program launched in July. But recognizing that it was a lot for some practices to apply to, and that we also had some practices who were mid-stride and some changes that would enable them to qualify for a higher reimbursement level, we decided to reopen that application on the early side. We received practices we received applications from 11 new practices, which was very exciting. As well as applications from 29 practices to get reassigned to a higher tier. And I believe we're still processing through those, but we're really seeing robust participation in that new program. So are excited about that. I also wanted to note that as many of you are aware, MaineCare has been working with Bamboo Health, formerly known as Open Beds, around their treatment connection, which is a service locator tool to help individuals, families, as well as providers identify services, behavioral health services that are available, and request information, request referrals. We have been going through a series of webinars for providers on that new tool, and the last currently scheduled webinar for that treatment connection tool is actually tomorrow from 11 to 12. And the last update I have, and then I'll see if others from my team have anything else they'd like to share. I don't think we've talked about this in the MAC, but I think it's exciting. And so I wanted to note that as a result of legislation that passed last year, I don't have the LD immediately handy, but effective January 1, we are going to be able to provide coverage for donor breast milk. We are one of a handful of states to provide this coverage, and I think that it's really good news for parents and babies out there. So excited to share that change. And thanks, Eric, for updating that link. All right, Molly, did you have any items that you wanted to share?
Yeah, I'll just share one, which I'm a bit of a broken record on, which is about electronic visit verification for home health and hospice providers, section 40 and 43. We are in the soft launch period for both of those sets of providers, and we will be going live fully on January 1. We are making slow but steady progress in seeing providers get set up with electronic visit verification. And we are monitoring the numbers every week, and we're also helping to escalate if any folks are having trouble connecting with SIN data or Gainwell. Our provider relations team has and the Gainwell team have very valiantly been trying to reach out to all known home health and hospice providers, especially those for whom we're not seeing that the providers have started submitting any visit records yet. And they've been able to make contact with a number of them, which is great, and start to work through the process. But there are a number of providers for whom they're really having trouble reaching the providers, can't seem to find the right person, or aren't hearing back. So if anybody out there is able to help us reach any of those providers, please let me know. I've already been in touch with Laurie and really appreciate Laurie's help on this. But if there's any other folks who represent home health and hospice providers, and you think you can help us reach those providers to get them set up, please reach out to me. Thank you. And I can put my email in the chat. Thank you.
Thank you all for those updates, and congratulations to MaineCare on your award. And I'm just noting that there is a question related to rates, which I think Lori just shared, so it wouldn't be forgotten. So we'll make sure we get that captured during the rate section of the agenda. So next up is our conversation around membership of the MAC. And Eric, I think that's you.
Yep, that is. So thank you all for your patience on getting our next round of appointments together. In the next 2 weeks, we will be sending out the appointment letters. And if you are a current serving MAC member from an advocacy group, either a consumer advocacy group or a provider advocacy group, you should be expecting to get a renewal, a reappointment letter for you or your organization. And if you want to change, who the person is, that's fine. We can talk about that, but we're going to be sending out those letters in the next 2 weeks. As you can see, we have Sue Chef joining us in an effort to coax Sue to join from a clinician perspective. And we have been able to coax Piper to join from a MaineCare member perspective. We're trying to meet, as Piper noted, our federally required obligations on those areas. Then the place that really leaves a discussion point is around provider organizations. We have a number of providers that are currently appointed to the MAC, and we also have provider advocacy organizations that represent providers. And what we would like to do is figure out, in the same way, our plan for members is to create a member-specific space. We will continue to have MAC member representation, but not this isn't necessarily the member-specific space where we're going to have robust member conversations. We realize that, and so we're looking to create an outside member-specific space. We would like to do the same sort of thing for providers, whether that is a subcommittee, part of the rate setting subcommittee, a set of subcommittees around specific topics or issues. Currently, we have a number of provider advocacy groups and then a number of providers, and it actually makes it makes the MAC much larger and sometimes harder to figure out how to condense the conversation into the specific topics where MaineCare can, where we can, figure out how to direct MaineCare policy. So our proposal is that we create a provider subcommittee or provider subcommittees with representation to the MAC, either through one of the provider representative advocacy groups, or possibly through a provider, but we're looking to eliminate or reduce the provider seats and create a provider specific space. So this is kind of a two-part thing. For advocacy groups, whether you're a member advocacy group or a provider advocacy group, you should be expecting in the next 2 weeks to get your reappointment letter. And then there's a question on the table of what does that, what does that space look like? What does that, what do providers who are part of the MAC currently think would work for creating a provider feedback zone and space?
And can I just ask a question in terms of those potential subcommittees? Would they have MaineCare staff in attendance at those meetings?
I think that's like, so part of the question is what the subcommittee is like, and what the, like if providers want to talk transportation, would we make some connections with the MaineCare non-emergency transportation folks? Yeah, that's kind of the point here, is to figure out what are the subject areas that are important to providers that we would, that we would want to be talking about, and how do we pair those up with the appropriate folks at MaineCare? But like, I think there's if it's a provider subcommittee, that there are, then what are the specific issues that need to be raised, and how do we talk, like how do we engage about those specific topics? Does that make sense, Kathy? Like,
Yeah, I'm curious to hear what others are thinking, and I see Laura's hand.
Yeah, Laura.
Good morning, Eric. Could you just clarify for me the initial part of the proposal? Did you say the intent is to remove MAC members that represent individual provider organizations as well as provider associations?
No,
Thank you.
I did not say that. Thank you for asking that question.
Yeah.
The provider associations, MAXB, Maine Hospital Association, the associations that represent these provider agencies, in the same way that we have significant representation from member-focused agencies, will remain on the MAC, and we'll be getting reappointment letters in the next 2 weeks. So we will have significant representation of provider interest through the associations that represent providers. Does that answer your question?
Thank you for the clarification.
Cool.
Other questions, Mark?
Yeah, my question is kind of consistent to yours, Kathy, around just the structure, the staffing, what would that really look like? I mean, I see some value to having provider-specific, really deeper conversations. When I think of a number of issues that come up, whether it's EVB, the rounding rule coming up in January, like things that are really specific that would be helpful, but I don't want to lose I think this group has been helpful to be part of, and as a provider, I would miss that, just candidly. I find a tremendous amount of value. Mallory and Laura do tremendous jobs in trade associations representing providers, and I can understand kind of the logic here, but I think it would really depend on the commitment to that provider group from the department, and how are we going to, is this going to be a place where, I wouldn't want it to just be a place where grievances are like aired, and want to make a real working group that there's engagement on both sides to work through issues. I even think of like the COLAs, the enrollment, that has come up the last couple MAC meetings around, boy, it seems like it's going slower than it had been. Like, are there going to be folks there from MaineCare that can really help answer those questions, be fully engaged, bring it back here and move the needle?
I think it's a fair question, Mark, and part of it is Like when we look at the current provider participation, it's not broad across all MaineCare providers, right? Like we don't have a representative sample of the folks who are paid by MaineCare as the providers within our provider representation currently. So so trying to figure out, how do we choose which providers to appoint is a interesting question, versus how do we create a provider space that can really hone in on what those questions and issues are. I think your question is one that, to me, what are the specific things that providers would want to talk to MaineCare about? Like that's not the purview of the MAC overall. That might be like a provider subcommittee could flag the 4 things that MaineCare needs to show up with some collaborative approach to those enrollment, or what, like it's the difference between flagging problems in the big meeting and getting into the details in subcommittee work, which we've seen work pretty well with the dental subcommittee, trying to think about how we would do something similar with providers. Mallory.
Thank you. Thank you for clarifying some of the questions that I had, which are similar to what Laura and Mark asked. So with the question that I have is, there's MaineCare, and then there's the associated agencies around MaineCare that impact MaineCare, like licensing and auditing and all of those pieces. And oftentimes there are issues with providers that intertwine all of those agencies. And, if we were to have like a provider subcommittee, would we be able to have some more in-depth meetings where we bring those different pieces together in a way, because they do impact the provision of MaineCare services. And often there's not good communication between like licensing and MaineCare over an issue or auditing. And and we don't really get to those that much in the MAC. But would it be an opportunity to have some of that, is a question. And 2, the issue raised around staffing and having folks at the committee, it seems that we would still want to have some MaineCare staffing and just for things like the, agenda setting and notes and some of those more official pieces, that we'd want to have it continue to be more official and not just leave it up to whoever happens to be chairing that subcommittee. So those are some questions too around how would that work?
Yeah, I think like I'll respond to that in 2 parts. The first part is those in-depth conversations aren't happening here, right? Like it's not the time or the place to get into. We can give you an overview on provider enrollment stuff, but and that sort of thing, but we don't get into the detail. And this is like an effort to create and form that detail. I think the question about staffing around subcommittees has come up a number of times. I think rate setting is definitely would be a helpful asset. And MaineCare shows up and provides specific information to questions in those sorts of things. Like, what do the providers want to talk about, and does MaineCare show up to discuss those issues? I think absolutely. When it comes to agenda setting and note taking, that's not something that MaineCare has the capacity to do. Like these are the areas that are going to make impact in the success of organizations. And I think like that's the association role, is to like coordinate providers and ask, help frame these questions for us. And that's where where the idea of like, is it a provider representative to the MAC? Is it one of the associations representing to the MAC? But like, there are resources in these organizations, and we've been doing this with the Maine Dental Association. They've been taking the lead on asking specific questions, and we're getting into more in-depth conversation. Like dental really looks like a good model for this, and it gets to the heart of real questions that there just isn't time in this space. Does it solve things? Not quickly, but it gets some traction. Does that? And I realized, Mark, I ran right to Mallory without saying, did I answer your question? So I guess I want to pause and kind of for both of you and say, does that make sense? And am I addressing your questions?
Yeah, I think for me, Eric, it's also about efficiency. So if there's a more efficient structure that really move the ball further along, I don't know if this proposal would do that or not. I really don't know. If it's just one more step in a in a long chain of steps to get somewhere. So for me, it's just about efficiency, and it's been really, really valuable to be here to hear kind of where it's at and be able to share with colleagues and whatnot. So for me, it's like, is it an opportunity to really get things done more efficiently, faster?
And to that point, these meetings will never be closed, right? Like the ability to participate in these meetings. We have non-members here. You don't have to be a MAC member in order to be present. So like that's where it's kind of like, but yes, I agree. We're not just looking to create extra work for anyone. We're looking to create a better structure.
I'm going to jump in, apologies to Rachel, we'll get to you in a second, just with a few thoughts. As Eric has come on board, it's been a good opportunity to kind of think about, like, what is the MAC and what are we trying to do and what's working and what's not working? And just a few themes from those conversations that we're trying to get at with the changes that Eric is talking about. One is we like the MAC to be, I'll say, a balanced space in terms of looking at who does MaineCare serve, and that we've got a good representation around the table of different interests and topics pertinent to the MaineCare program. And I think it's safe to say that we have, like, I'll give an example of transportation. Transportation is an issue that is really critical to MaineCare members. We absolutely have individuals in this group that are impacted by transportation and have some experience, but nobody who really has that expertise, right? That's just one example. And so one question is are we really balanced in terms of the scope of things related to MaineCare that we talk about in this group? And then secondly, like, what kind of discussions are we having? The size and the format of this meeting does not make it the greatest place to have substantive discussions, right? We have lots of updates and questions and follow-up answers and some presentations. And some of that is totally appropriate, but we've talked about a desire to, in order to move to some more substance, that the substance really should happen at a subcommittee level, because that is when there is time and expertise to dive into issues that can then be escalated back to the MAC for a presentation, or this is what we've decided, what do you think about that? And related to that, we've also been having conversations about this is not our group. Like, this is not the group of the Office of MaineCare Services. This is your group. And we would love to see more direction of, like, the MAC is its own entity. What does the MAC have for its own strategy or goals for the year? Like, we've never gotten to the point of the MAC acting as its own entity with its own objectives, which I think, especially as we have conversations about changes in administration, et cetera, that it'd probably be good for everybody to get to a point where, like, the MAC is a body that feels ownership and has its goals and can work towards those, right? And that's not what we are right now. And that's not, like, MaineCare's job to say, hey, MAC, these are the goals we want you to have. We could do that, and it might be in selfish interest. But those are some of the conversations that we've been having and trying to figure out, like, how could we get there? And our current structure doesn't really achieve that. And I'll also say that, like, from a federal perspective, and also as we're trying to work on doing a better job with engaging members and being member focused, like, the current MAC is not, you all do amazing and important work that impacts members, but this is not a friendly space to it's a difficult space to be in if you are not deep in the wonky weeds of Medicaid. And so that's another aspect of the conversation is, like, how do we have this space be a space where we can raise issues of interest and make progress on kind of broader objectives that will benefit the Medicaid population that are not, like, so provider specific. I rambled on for a little bit, but those are like the conversations we've been having. And when we're talking about membership, where we're overdue for figuring out who specifically is on the MAC, and we also don't want to have a giant group that makes it more difficult to have conversations, like, that is where we came to the recommendation that, you know, we're provider lopsided, and we have provider associations and in certain cases individual providers, and to make space for having, you know, more members and clinicians and focus on areas where we don't even get to spend too much time, like, we need some structural change. All right, I'll stop. Rachel.
I'm sorry, I'm going to take the prerogative as chair to interrupt before Rachel. I'm sorry, Rachel, and others who have their hands raised. But I do just want to say to what Michelle was just saying, like, I think that the information sharing is really important, but there are so many requests around information sharing, to the point of what Michelle was just saying, that there is not time to have more substantive conversations. So there are things that, like, we touch on around the edges, but then when I'm trying to figure out, like, could we think about making this an agenda item in a future meeting? Like, there's just literally no space. And I do think, I'm not a provider, so I recognize that, like, I don't see all the issues that you all are seeing, but I do think that, some of the updates are things that are already getting shared electronically, and if people, like, have questions about those things, creating a space where you could dig into those questions that applies to everyone would be really helpful, to everyone who's a provider, as opposed to, like, everyone here in the MAC, because there's a whole lot of things that we touch on each week that, like, really have nothing to do with the work that a lot of us are doing, even though it does affect the work we're doing because it affects providers. And in terms of, like, thinking about, do we want to have a strategic plan? Do we want to have some set of goals? We don't have space to have that conversation unless we find a space for some of these other conversations to happen, unless we just stop having those other conversations, and then there wouldn't be a space. So I'm just saying that out loud. At least that's my perspective. And also to MaineCare, I would also say, I do think that if the goal is to create a space where providers really want to participate and see it as useful, that even if MaineCare cannot staff it with, like, agenda setting and note taking, that there needs to be people from MaineCare that have enough of a level of leadership or, like, authority to feel like they're getting heard. Because I think part of the reason why a lot of the issues get brought here is because they want to make sure that people who can actually influence them hear it. And so, and some of that could come back to the full MAC, of course, from the subcommittee. But I do think part of why we got more provider engagement in the dental subcommittee is that once it was required that MaineCare actually had to be at the meetings in order to plan the benefit, like, people saw a real benefit because they were actually talking to people from MaineCare and not just to other people who are already connected to them. So just naming that out loud. Rachel, and then Kathy, and then Sarah.
Yeah, so I think I'm sorry, so much has happened between when I, like, formulated my question. So I touching on, like, what Michelle said, and then to Kathy, what you just mentioned, you know, I recognize that, like, members can't access services unless providers are, like, you know, are doing all this work behind the scenes. But I feel like there's a large member voice that's not being heard. And I don't know that this is a really welcoming place for members, because even we start talking about rates and I'm just like, whoa, I'm gone. Like, so when I think about like wanting to expand that and make space for member voice, which I know MaineCare members are supposed to be a part of this team, I don't know how we could maintain that membership when there's so much else going on. So, and I'm not by any means like diminishing the necessity for providers to have these really good conversations, and also for all of this to kind of come together and where some of the overlap is and these really great opportunities. So I just want to, as someone who works with consumers every day, and I hear a lot of stuff from members about the materials they're getting and they don't understand and they don't know why this happens this way. And I would really love for this to be a place where members can come back and say, hey, I don't know why I keep getting mail. I don't know why I can't get a hold of somebody at OFI, which are just some of the really common ones. So and sorry, I hope I'm not repeating things in just a different way.
It's okay. Thanks, Rachel. Kathy?
Hi. As I've been attending these for quite a while now, got interested in it because I represent Section 60 DME, and that didn't seem to have a voice in this place. Additionally, as I noted in the chat last month, I am a guardian of my sister who receives services as a person with intellectual disability, brain injury. So I look at it from all perspectives, and I do agree with a little bit of what you're saying. I reached out to this organization from the perspective of, okay, there should be a representative for Section 60 on this group, like all the other groups and whatever. That's what I assumed. But I know when I had started attending these, I was told there wasn't any space. So I think the effort is great to reconsider how this is made up, and if it's a place for associations that are representing different provider groups, then it should represent all provider groups. And I just wanted to kind of emphasize that. Thank you.
Thanks, Kathy. Sarah?
Thanks, Kathy. I'm not sure I'm going to be adding anything new to the conversation, but I guess I wanted to just sort of, as an acknowledgement, some of you, I think like maybe a handful of you, know that I was on the MAC several years ago. And during that time, there I think was a challenge in developing the agendas and making it a meaningful process, because it really, ultimately, it came to be this sort of 2-hour information dump every month. And it felt like we would get information, we would try to suck information from the department to the extent that it was freely given or not so freely. And then we would go on with our lives and each in our disparate, roles, and then come back the next month and repeat the same process over and over again. And it really didn't feel like we were doing what fundamentally the MAC was about, which is really digging into the issues about access to services and utilizing the services and, addressing the, provider, but also, member complaints. And so I know that Kathy and Michelle and everyone at MaineCare on the committee has really worked hard to steer the ship in the right direction. I don't envy you in doing that. And I think though that I realize I represent a member group, or at least I'm substituting for Atlee, who represents a member group. I'm not a provider group, but I do see the value in really, where 51% of the membership is supposed to be member focused, and sort of looking at my screen and not seeing that. And I think that there's a challenge there in increasing those numbers. But I sort of feel like that focusing on the advocacy groups that represent those different consumer or provider focused areas it seems like a good way to go, because I think when, we start talking about, if we were to say who are the providers that should be here, then you're talking about, well, you have your developmental services providers, your mental health providers, your children's providers, your transportation providers, your brain injury providers, elderly and all this. And, there's dozens, if not hundreds of providers throughout the state, and where the membership is supposed to be small. I think that really thinking about individual provider agency representatives would be a difficult task. But anyways, I guess I was going somewhere with this and I completely lost my train of thought, but it was really about, I see the value in having it member focused and really digging into those issues that directly impact members. And so, for example, like somebody brought up the transportation services, and then also what happens when the public health emergency does eventually end, and how are those members going to access the critical services that may be necessary for their day-to-day life, but they've also come to rely on the past 24, or who knows, maybe by then it'll be 36 months, and sort of those shifts. Anyways, so ultimately, I guess it's basically like, I like the direction this is going. If people haven't reviewed, I think, Eric, remind me if it's changed, but I think there's still the MaineCare benefits manual. Chapter 1, section 1.23 outlines the MAC membership and duties. And so if people haven't taken a look at it to see really what people are operating from, it might be worth a look, because I think it really does provide some context and support to what's going on. And it's not necessarily just sort of operating at their whimsy. Although you may be, I'm not discounting that, but I mean, there's sort of some foundation here to that happening. And I'm going to stop now.
Thanks, Sarah. Eric, and then Mark, and then I'm going to wrap this conversation up for this meeting. Eric?
Yeah, just to say, one, MaineCare does not want to stop having interaction with providers. Your feedback is critical to us, and we need to figure out a structure. The MAC structure is laid out in the MaineCare benefits manual and in federal law. Does that mean it's the best structure for MaineCare to collect feedback from its various stakeholder groups? Absolutely no, it does not. We have to figure that out. And MaineCare has to figure out, and providers have to figure out an effective manner. And I think LD 1867 is like a step towards effective conversations between MaineCare and providers on rate setting, but that's not all of the issues that providers have. There is no part of this conversation where we are trying to get out of our responsibility to have excellent relationships with providers, in addition to MaineCare members, in addition to all our stakeholders. It's recognizing and saying we're not quite nailing it. Some of these conversations about strategic plan and what's the MAC's role and how does the MAC balance and push MaineCare and advise us on what we need to be doing better, we're not quite nailing it. And I think everyone sees that and feels it. And our, Michelle's prerogative under the MaineCare benefits manual is she gets to make the appointments. Well, so this is a conversation about the appointments for the next round of MaineCare, but that doesn't solve the challenge that this is really the only, this is the federally mandated place where we have these stakeholder engagement conversations. Let's figure out how to do this well.
Mark?
Yeah, mine's really quick, just like a practical observation. I think you're probably going to see the same people attending regardless, unless the agenda really shifts and you do other things. But I think this group has been committed to meeting for the last several years and probably will continue to show up here, whether members or not. So in terms of the efficiency piece, yeah, I mean, I don't know. It's food for thought. I don't have a.
And we're not trying to get out of having that feedback. That's the thing, is we just want to figure out where do we funnel it so it's effective.
Yeah, fair enough.
Yeah, I mean, I would love to see a space. I I think you're right that probably people are going to still come, and that's fine and great. And there's many people here right now who are not MAC members who get to ask questions and who get to share their thoughts. Kathy's a great example to share her thoughts about this, is not technically a MAC member. So obviously that could change with a different chair, like, but my approach has been like, if you're here, we want to hear from you. So that's what I'm planning to continue to do. I think for me, it's creating a space so that some of what's happening now in these meetings could happen in a different space, so that we have a little more space in these meetings to actually talk about some of the stickier things that we could talk about across all of the ways that we interact with MaineCare, whether we're we're all member focused in various ways. I see Jillian saying that, and like, that's totally true. But whether we're member focused in terms of directly in terms of our work, or whether we're provider focused in terms of our work. Valerie?
Thanks. So I know, due to the legislation that passed that codified the rate setting subcommittee, I would want to see the rate setting subcommittee obviously stay as its own standalone subcommittee. And rates are not all that concern or issues for any providers. So I see Eric, yes. So the rate setting subcommittee would continue, and then we would have like a separate one where providers would meet and discuss these things and bring MaineCare various offices or whatnot to them as needed. Members would have another subcommittee where similar things would happen, and then we would like report out from those different groups to this. Is sort of what you're thinking. I just want to make sure I have it fully in my head. Okay. Okay.
Okay, so I'm going to wrap this conversation up for now. What I think would make sense is, one thing we would need for this to work, if we are moving in this direction, is to have someone who's willing to chair that subcommittee. And I know people didn't come into this meeting with this as something they were thinking about, so not trying to put anyone on the spot. And being chair, it does require some work. So like in terms of pulling together agendas and facilitating the meetings, the chair of a subcommittee needs to be a MAC member. So just keep that in mind, though other people can certainly help. So why don't we plan, I'm going to make a suggestion and then you tell me if you have pushback against this, that we can check in about this in January and try to have someone volunteer to be the chair. And also, I think it would be good to talk a little more about maybe what the scope of that subcommittee would be. Like, what are the things we're thinking about might move to that space? And that could change too as that group comes together. And what are the things that might stay in this space? And then also, I will, at the January meeting, I'm going to also suggest another thing that I can do in advance of the meeting is remind people of those bulletin updates that you can read in advance, so that if you have questions about an update, we can still check in about those during the MaineCare updates, but that would take some of the need for like those oral updates to come off the plate. Some things probably still need to be lifted up, but not all of them. And then we can take some time in the January meeting to think a little bit more about a plan around goal setting for the MAC. And not that we'll set the goals in January, I don't foresee that happening, but just thinking about the process for us to do that. If anyone has concerns or pushback for that, now would be a good time to lift those up. Mallory?
Yes, I know that there are some state Medicaid advisory committees that are pretty robust and do a lot of this type of goal setting and whatnot. I'm almost wondering whether or not having somebody join us to talk about that might be helpful. And what they have done and such. I don't know what others think about that idea.
I always welcome help if there's someone who has thoughts about things. Maybe Mallory, you and I could connect about that and think a little bit more.
And I can also offer, Kathy, that actually I haven't heard from other states about whether their own advisory committees have had strategic planning conversations. Is an interesting question to kind of put out there because I know that there have been some examples of interstate sharing, for example, around member committees or subcommittees. So it might be a good opportunity to hear from other states. And we can also have an internal conversation about some strategic planning resources that are available to states through the National Association of Medicaid Directors. And this might be, I don't know if it's an allowable use of that resource. It might be kind of new, but sort of exciting to think as to whether or not like that resource could be helpful to this group. I don't know what the answer is. I'm not going to commit to that because I don't own those resources, but we can do a little homework there. I just want to shout out that Eric put a link that is where you sign up to receive MaineCare bulletins, which we often call e-messages. It's the same link that is for all of DHHS when you go to that link, and it is for the MaineCare piece. It is split out by section of policy as well as member-focused e-message. So if you are not signed up for those, please do sign up for those. And I agree that we can take things off the agenda if we know that folks are paying attention to those listservs.
That's great. Thank you. And thank you, Mallory, for offering to attempt to chair a group if that's the way we go. So let's move on because we do have some other things on the agenda today, including one that does require a little more discussion. So wanting to make sure we have some time for that. Next up is our updates around the rate system process, and a reminder that we do have a subcommittee focused on rates, and that part of the goal is to move the more in-depth conversations around rates to that space, but wanting to continue to have this as a space where things that need to be lifted up for everybody can happen. And Michelle, I think I'll pass it back to Amanda.
Mandy and I are going to double team today, and I appreciate her patience for my often last minute style of getting work done. So sorry, Mandy. I'll get used to it. There is a lot going on right now, so it's good that we have this time. And before I forget, I do want to say ahead of time that I will need to leave right at 11:30. So FYI. First up, thank you for those who have participated in our process around setting forth our schedule for rate determinations that is required under Chapter 639. Last week, we posted a summary of a pretty detailed summary with an executive summary of the comments that we received during that process. This week, we are on track to post the final schedule. We are also hoping to update our website this week, and so the notice will need to go out when the website is ready. I will give everybody, I'm not going to withhold the information until an e-message goes up, and so I'll just let folks know that we are not making changes to the proposed schedule that we have shared. I will say that there were this is a really high level version of our executive summary, but the two main pieces of feedback that we received about the proposed schedule, one was a thank you and acknowledgement for, I'll say, bumping up clinical and nursing services across a range of sections of policy to the schedule. And then the second area of comment was the fact that for section 21, and I think 29 may have been mentioned as well, that the rate adjustments that have been, the multiple rate adjustments that have been made for those sections have not fully followed the Chapter 639 process, in large part because many of those adjustments were before 639, Chapter 639 existed. And so as very valid feedback, when we were looking and discussing the comments, where we have landed is really that as we've talked about and presented, a lot of what is on the proposed schedule, we are have already committed to doing prior to Chapter 639, and or we are bound by statute to conduct those rate determinations. There are not many areas of service that are on that schedule where we have much discretion. And we do not have the capacity to add another large, excuse me, another large swath of services to that schedule. And we cannot take anything off that list right now. And while we agree that there can and will be improvements to rate determinations for sections 21 and 29, there are other services on the list, for example, PNMI's E's and F's, where there has been, where there are more, I would say, underlying and substantial issues with the current rate methodologies as well as amounts, and there has been less action to ameliorate those issues for those services than there have, for example, for 21 and 29, where we've received a lot of comments. So not easy decisions, but we are going to be sticking with the initially proposed schedule, and that will be posted this week. I will move on to talking about, well, actually, no, I will break there. And Mandy, were there, did you want to share any additional detail around the schedule?
I was just going to, I think you covered everything. Yeah, that we noticed it on the 23rd, the comments. We received 33 comments overall, including written and public, and that we're sending out the final schedule by the end of the week.
Okay, great, thanks. All right, so next I will talk about the implementation of new rate studies that are underway right now. Many of them related to Part Quadruple A, but broader behavioral health as well as targeted case management studies. We are still working with the goal of 1/1 effective dates. I really had hoped and wished that I would be able to share additional detail with you today about specific implementation timelines. I imagine it's frustrating. I do not have that detail. We have received many comments. We are diligently working through all of those comments and making sure we have responses and decisions, and have to then incorporate those decisions back into the rates. So this is our utmost priority, and we are working on it, and we'll share more detail around timelines as soon as we are able. And I'm sorry that that is not today, but again, the goal remains to have January 1 effective dates. I can say that particularly for the rate determinations for sections 2, which is adult family care homes, 26, day health, as well as crisis services within section 65, those are on a later time frame. And that's basically what I can say right now. So I know that that is not as much information as people would like, and I apologize for that. Again, it is our priority. I think there was a question as to whether there would be the potential to have payments go out kind of in interim until the new rates are implemented. I do not think that there is an opportunity for that. It would, we'd need to figure out what are those amounts and what is the authority, and have a full swath of work where I would rather focus our efforts on getting the actual rates implemented in as timely a manner as possible, with retroactive billing to January 1. All right, and I will turn to Mandy, who has more specific details around dates of engagement and where we're still taking comments, et cetera, on a section by section basis.
Thank you. So For adult family care homes, we're planning the public presentation of rates by January 12th. Per quadruple A, the effective date of the rates will be retro to 1/1/23. For community, what is this? Keep forgetting. CCBHC,
certified
clinical behavior.
something like that.
Certified.
Certified Community Behavioral Health Center.
Thank you. I didn't write it out, so I forgot. So CCBHC for short. The RFP was submitted and we've extended our bid deadline to December 9th. And we are planning to start scoring those bids December 14th and 16th. That's quite the process. Prices was, we presented the rates to the public November 22nd. Those comments are due December 9th. We are working per quadruple A. We are working toward retroactive implementation of January 1 effective dates of rates for crisis services as appropriate, but broader crisis reform work is ongoing and there will be future communications on that in the coming months. For day health, we presented rates to the public November 17th. The comments are due December 6th. Today, yep. And per quadruple A, effective date of rates will be retro to 1/1/23. Family planning, the contracting process is still ongoing and underway. FQHCs, federally qualified health centers. We held 2 technical advisory sessions to go over surveys with providers, answer their questions. That was Tuesday, November 29th, and then yesterday, December 5th, we held the second one. And the planned effective date for those rates is 3/1/23. Nursing facility and residential care facilities, the contracting process is underway. And psychiatric residential treatment facilities, we are still working with OCFS to finalize service model decisions related to rate setting. Section 23, we presented rates to the public November 30th. Those comments are due December 15th. Effective dates are estimated for late fiscal 2023 or early fiscal year 2024. In section 60, we presented rates to the public December 1st. Those comments are due December 15th, and we're looking for an effective date of 1/1/23. Michelle?
And I will hop on to talk a little bit about hospitals. And so a notice went out yesterday for distinct psychiatric and SUD, otherwise known as medically supervised withdrawal or detox units. We have set up a meeting on December 19th for hospitals to discuss proposed rate model for those services and also to get additional feedback in terms of our current what is known federally as Institute for Mental Disease or IMD services. We are working to select a date to convene stakeholders to initiate data collection on those services. MaineCare does not pay for adults in those settings, as many know, and so in order to determine whether there's an alternate model to those services moving forward, we need additional data collection. So we'll be setting up a meeting to start that process. And then in terms of broader acute hospital payment reform, we have started some preliminary internal analysis to prepare for a kickoff to start engaging more broadly on that front. All right, so that was a lot of info. Any questions or comments?
Mallory? Mallory, I think you're freezing. Unless it's me.
I'd say she's totally frozen.
It's not you.
We'll go to Suzanne and then hopefully can get Mallory back. Suzanne?
Restate what you were talking about with the CCBHCs. It was hard to hear and I couldn't quite capture what was being shared.
What was the
CCBHCs, basically we're in the procurement process, so we're moving through the RFP process for those services.
Thanks.
Sorry, I guess I froze when I had my question. By the 1/1 date, 23 date for the effective new rates for the behavioral health rates that you're studying, are you going to be able to work through all the rules to set those in place by then so that they're finalized?
You want to talk about that?
Yep, no, Mallory, this is Jenny Patterson. I think our intention is to do the SPA noticing so we can have federal approval with a 1/1 effective date. And then the rules themselves will end up being retroactive, but we think that will be possible in this circumstance.
So potentially providers will be able to start submitting claims under the new rates on 1/1 before the rule process happens so that they don't have to retro bill.
So that brings into play the third question, which is when will the rates be implemented in the system? And we don't have an answer on that yet, but we're certainly striving for 1/1.
Okay.
But to state in a different way, we can say that we do not think it will be necessary to wait for full rulemaking in all instances for providers to be able to bill. But we're still working through because we need to finalize the rates and get them into the system, et cetera, what the actual implementation dates will be to go live with that billing.
Okay, let's pass it over to Laura then for the subcommittee.
Thank you. So the MAC rate setting now system subcommittee meets monthly, generally the last Monday of the month. We met just last Monday, the 28th of November, and I will put in the chat, but a reminder that everybody is welcome. We are meeting because of the holiday. Our next meeting's on Monday, December 19th at 2 p.m. And we had a great meeting last week. We welcomed certainly Piper as a new MAC member, and Mandy and Eric from OMS were on hand to answer some questions, but also to review the new rate setting web page. I think that's been shared with folks before, but we can also put that in the chat. And that is, an ongoing being built page that just has, all the helpful resources and in the long run, a place for folks to go to look at history of rate determination and rates and other related items. So I do think, oh, thanks, Eric. I see right there. So I think that a couple of things that we talked about, we were looking at the proposed rate determination schedule and really appreciated the comments being posted as part of that new process. We look forward to the posting of the final adopted schedule and appreciate, Michelle, your update about what we will and won't see based on some of the comments that folks received. We also talked about current rate studies and timing, and I appreciate your update today, particularly about talking about the difference between an effective date and the implementation timelines. And one of the questions I have for you regarding the implementation timelines is, would you expect that by the end of the month, or would it be in January that we might know more about implementation timelines for that package of behavioral health and case management rates that were under a study with Burns? So that might be one question, and I can pause now if you know that we might know more about that in late December or January, or it may be after January that we would know more about implementation timelines.
My goal would be that you would have more information by the end of the month.
Oh, that's great. Okay, thanks very much. We also discussed the COLA, and it was really terrific to see, and thank you to you and your team for all the hard work of processing the COLA, but also at the same time releasing not only just the COLA of 8.2.4, but also all the January 1 tables that went with it. So that has been great news to be able to share. And a question, although I believe it is the case that folks will be able to access those January 1st, the ones that came out in the OMS memo on December 2nd. But is that something that you could confirm this morning, that I know they're effective January 1, but will they be implemented as well?
Yes, I was sorry, multitasking. Thank you for reminding us of that good news update, Laura, because it was on the list and then we skipped right over it. So I just
It's significant.
don't take credit, right? Just put into the chat the link to the update about all the 1/1 updates that are for January 1.
These are the ones that got them.
Yeah. So 12, 18, 19, 20, 21, 29, 65, and 96. I want to double check on those services where there's the interaction with the ODES EIS system. I know there's been lots of work and communication between our teams, but I don't want to commit right now to those going live January 1 because I just don't have confidence that I'm completely up to date with those conversations. So I think the goal is 1/1 for all of these, but let me just confirm that. For
I appreciate that. I was a little silent on it when I was sharing it. And then I thought, let me just ask today. So any additional information would be welcome. Thanks very much. And thank you again for having both of the COLA as well as the new rates come out at the same time and early in December. So folks can be thinking about that budget and support for programs and the staff who serve and support MaineCare members. We really appreciate that. The last thing that we talked about, in relation to rates and is the rounding rule. And, we discussed the Chapter 1, Section 1 component that is effective January 1. We shared at the last meeting a recommendation for additional delay. There are vendors for software and providers that are everybody's so short-staffed just to catch up their systems to be able to accommodate the changes, as well as one of the components we discussed in the subcommittee was that with the new rates coming in January, so folks have already made some changes that now and perhaps some of the earlier in the month information may help folks catch up, but there was concern about new rates and that new change coming at the same time. And we appreciate that when the comment period happened earlier, I believe last summer, that a extension to January 1 was made, but providers from the committee are still asking for an additional delay in that component. And I invite anybody else from the committee, if there's anything I forgot to mention, please feel free to share. Thank you.
So I will look to my team, Molly and Jenny. I have not been part of broader rounding rule implementation discussions. That might be something we need to circle back with this group on.
Yeah, I think that would be my suggestion is maybe we'll need to have a separate conversation about it. We definitely did talk about it at the last MAC meeting and we to talk about it. I was not aware that the meeting, but certainly we want to be providing, support for providers as we move forward. And if there is an interaction with the new rules that we should be considering, then I think we'd like to hear more about that. But I would want to loop in Molly's provider relations to see kind of with specificity, what are the issues that are being raised? I know those things.
Jenny, it's really hard to hear you. You're gonna have to speak up.
Okay, sorry, I thought people could hear me with my mask off. So thank you, Eric. I think I would like to talk with the provider relations team and with providers just to understand with specificity what are the issues that are coming up, but we're certainly open to having those conversations.
Thank you. And Jenny, I'm happy to reach out to you and share more detail. Thank you.
Mallory?
Thanks. I guess I just wanted to follow up on that and ask, so is there an extension for the rounding rule implementation or not?
There was an extension to January 1. One of the things I said that maybe people didn't hear, I wasn't aware that it had come up at the rate subcommittee meeting until just now. So if there is an interaction with the new rates coming online that makes it more complex, I think we'd like to understand a little bit more about it. So
we will we'll escalate that internally and get back to you on that question, Mallory.
Thank you all. So let's move to our rulemaking waiver spa packet. And for new folks, this packet gets included in every MAC meeting, and we create space. We don't have specific questions for this month's that came in advance, but folks can come prepared with questions if they have them. So Jenny, I'll pass it over to you.
Great, thank you, Kathy. And I actually have probably a pretty brief update, so it's fine that we will not need to use hopefully all of my time for this. And if people can't hear me, please let me know. So this packet, if you don't have a copy, please ask Kathy for a copy of it. This reflects the work that my unit, the OMS Policy Division, does in terms of rulemaking, state plan amendments, and waivers. And I think it's important, some of the conversation we were having earlier about how can folks who may not be familiar with all of the different benefits and the section numbers, this could be a good source of information for people because it does list the staff, the policy writers that work with each section of the MaineCare benefits manual. It has their phone numbers there for contact, and it does list the subject matter of those sections. In general, what this packet does is it highlights those rules that have an open comment period, those rules that have been adopted since the MAC meeting, and we don't have a lot right now because behavioral health services rule this one. So we've just been talking about just after the last MAC meeting. And as folks are surely aware of, the policy staff have been very involved with the ongoing rate work. So as soon as the rate determinations and the rate studies that are underway are completed, then we will move to rulemaking on many of those sections. So that's why there's a little bit of a hiatus. So I think we also had on the agenda to talk about section 106. That section does not currently exist, but that's our new school services section that we have been working on for quite a long time. And I am hoping that we will be proposing that rule sometime pretty early in the new year. I was in touch with Eves and Kathy. It's our intention to have one more stakeholder session on that rule. We had a series of stakeholder sessions last January, and much, if not all, of the information that we presented then is still true, but we want to do an update just on where we landed on a few things that were the subject of comment. We had thought we would schedule that for December, but given everything going on, it's most likely that that'll be in January. But I just wanted to let folks know that we are planning to have some more stakeholder consultation on that rule and that it is really moving forward. I think part of the reason it had not moved forward earlier, again, as folks know, is that the new rates for some of the services that will be in that policy relating to children's behavioral health are part of the rate study, the behavioral health rate study that's ongoing. And so we want to have that full rate work reflected in the rule when we propose it. So I think that is most of my update. I am happy to answer any questions that people have. And there was something in the chat. Where can we find the full state plan? It is not posted on our website, so I would want to follow up on that. There's information about the state plan, so yep. I think the link that you just shared, Molly, that's where we post methodology notices for the state plan. So as we're talking about the rate studies and the methodologies that will be making public prior to 12/31, that link is where those will be posted.
There is on that page, though, that I just shared, a link to the CMS website where all the state plan amendments are for all states. So you have to go there and then filter by me.
Yes, Thank you, Al. That was the other thing. I was going to give staffing updates. So 2 staffing updates. Dean Mugai, who for 2.5 years has led our children's and behavioral health policy team, has now moved into a new role as an associate director of OCFS for children's and behavioral health, which is exciting for him, a big loss for us. So we will be filling that position. We don't presently have anyone in that position. And kind of on the positive on the staffing side, we had our EPSDT coordinator position was vacant for a long time, and Tia Baldick, who was formerly with the OMS Provider Relations Unit, is moving into the EPSDT coordinator. And she's actually in that position right now, which is very exciting for us.
Any questions for Jenny? I need to jump back for 1 second because I did have a question. I'm not totally sure we answered Lori's question about in the rate section of the conversation about the minimum wage change and whether that just automatically goes into effect or whether something has to happen for it to go into effect. And Lori, speak up if I'm not capturing that well.
Yeah, so my question had to do with the minimum wage bump goes in January 1st, and the new direct care worker reimbursement rate is 125% of that rate. So again, it's probably my own lack of knowledge here, but I didn't know is that all automatic now? Is there going to be a lag in minimum wage and then another recalculation? So there'll be some retro. I just didn't know how, since this is kind of the first year where it's going to be, tied to a minimum wage increase. What should our providers expect or be prepared for?
Question, Lori. That was actually part of the COLA announcement that went out that's posted in the chat. So yeah. So that will be in effect 1/1 as part of that kind of COLA and quadruple A minimum wage update. So that is
all right. I'll go pull that. Thank you so much. Sorry, I missed it.
No, you're welcome. Good question. And I missed it. But had asked that question. So thank you, Kathy, for flagging it.
Thank you. And Jenny, a question about the state plan. So the link that Molly shared, it's for CMS. That's where you find the amendments. Is that also where you'd find like the original state plan that all the amendments pertain to, or how would people know where to look for that?
I think that the state plan consists of all of the amendments together. So
okay, that's what I thought, but I wasn't sure.
Quite challenging to construct the entirety of the state plan. But those are the 2 best sources that are publicly available.
Okay. Thank you. Any other questions? Okay, let's move to communications updates, Eric.
Yeah, we've touched on the kind of crucial one that I wanted to flag, which is the rate setting web update. For a lot of folks in this meeting, rate setting is important, and we will be having, we are going to be doing an update to the rate setting website that will turn it into, that'll put the schedule on there, and it'll include links to kind of all the important things, important notices, important dates for any open rate determination process. So it'll be your one-stop shop for any questions about rate setting. Currently, like it's not there yet, but the update is going to be a big update. We shared it with the rate setting subcommittee, and they gave us some excellent feedback. So thank you to the rate setting subcommittee for taking a first look, and I think, to that point, when folks see that, if you have additional feedback, maybe bring that for the next meeting, because this is an important thing. You can bring it for the communications update at the next MAC meeting. And then additionally, I just wanted to, there was a lot of discussion about the bulletins, and someone, I can't remember who flagged, that it'd be helpful if there was an explainer about what the bulletins are, because like if you sign up for all of them, it could feel like a fire hose, because there are a lot of them. And I just want to, that is true. And if you go to the bulletins webpage on the MaineCare website, you can, there's a pull down menu to select a certain topic. So if you have been getting the fire hose of emails and it feels like too much, it might be a better pathway to stay informed about what's pertinent to you. Like maybe you signed up for every list that made sense to you when you were signing up, and now you see the volume of what that is, and that's too much. If you're looking for a way that is not so challenging, go to the bulletins page, and stuff is broken out into state and federal policy, and it's broken into pharmacies, and it's broken into dental services. So it is broken up. If you've signed up for those lists, you will have gotten all that stuff, but it won't be categorized in that way. So I just wanted to address that that question and issue that was raised in that conversation. We do recognize it is hard for folks to stay up to date on everything that MaineCare is doing before you come into that this meeting. We want to ask you to do the prep work, and we also recognize how much other work you're doing and how that could make reading all, I review every bulletin, and it's a fair bit of my full-time job. So like, just wanted to say we do hear that, and this might be a way for people to stay up to date without feeling like you're accepting a fire hose. Last thing, we are doing some new outreach work. We're doing some new marketing. We're developing some materials in collaboration with partners, and we'll be developing some video assets that are the stories of MaineCare members, and the impact MaineCare has had on their lives. And some folks in this group may be getting an email about a form to nominate members who you think might be a good candidate for our campaign. We're really taking a documentary style. If someone, we don't want to just say MaineCare is perfect, it solves everything, there's no problems. But we do know how it impacts and changes people's lives, and we're trying to capture that. Particularly the member advocacy groups. If you get an email looking for folks who you think might be a good fit to tell their story of how MaineCare has positively impacted their lives, please fill that out. We want to get the word out there. Lots of people, there's a lot of stigma around MaineCare. There's a lot of misunderstanding, and we want to have people telling their own words what MaineCare means. So if you do see that email coming from our marketing agency or the videographer we're working with, it's part of our CHIP and MaineCare family outreach program. So just wanted to flag that particularly for the member focused agencies. And that, I think, unless anyone has any communications related questions.
I don't see any. Thanks, Eric. So the last thing on our agenda, and Jillian, I might ask you to come off mute so you can share a little more of the context around this. But was to think about cost challenges with ER visits that may be unnecessary, but people can't find other providers, so they end up in the ER. I think this is also linked to some of the transportation challenges that Jillian was raising earlier as well. So Jillian, do you want to share a little more of what you were thinking when you asked to have this added?
Yeah, so part of our collaborative with MaineCare and having a behavioral health home is, reduction, of course, in like ER visits. And what we're seeing because of the uptick of RSV and the uptick of flu and the uptick, of COVID actually kind of playing out now, but the three viruses together are causing access issues to members. And what we're seeing is, say a member has nausea, vomiting, and diarrhea. Well, the only way that that member who has no personal contacts to give them a ride can get to be seen by a doctor is to call 911 and to go in the back of an ambulance and to go in through the emergency room where they get the treatment they need. And then maybe the next day they're back there a second time with the same means. And I'm just looking for some sort of upper level conversation, transportation committee, bringing it back. If we don't address transportation as an agency, we can't help reduce MaineCare's costs, because that's what you're going to start seeing. I mean, 10 years ago when I did nursing, we had to send people to the emergency room to get a Foley catheter changed because they couldn't access a Foley catheter in the home. If we can try to intervene on that, you know, we get notices from MaineCare that this person had, you know, they're a high utilization, a high user, but there's nothing we can do about that because we can't get them to the PCP. We can't get them to the express care because it's not in their town. I'm just thinking outside of the box, like what systematic things can we be doing to increase people's ability to seek non-urgent care in the appropriate setting?
Thanks. Molly, I think you muted yourself because of the echo, but we can't hear you through whatever other mechanism.
Sorry, okay, is that
Okay.
good?
Yes.
Alrighty, I'm gonna look at my computer, not at the big screen, so you'll see me on my little screen. Thanks for raising that, Jillian. I just want to remind everyone that we do have a very robust non-emergency transportation program that it sounds like is a perfect avenue for some of the transportation concerns you're describing. It is specifically for, okay, Jillian, you said you need a ride 3 days. It's actually 48 hours, and there are some exceptions to 48 hours. So I don't want to just say NET is not an option here. So I would really encourage members to call their broker. It's by region. There's a different broker for each region. I can put the link in the chat for our non-emergency transportation page. If members are trying to access rides through non-emergency transportation and are not able to or having difficulties, we do want to hear about that because we do work with each of the brokers, but we do need specifics. We need, you know, member name, date of ride or attempted ride. And I'm going to put in the chat our colleague Roger Bondison, his name. He oversees the non-emergency transportation program. Again, it's very hard for us to respond to generic concerns. It's much easier if we can respond to, you know, member name, date of service, date of trip, you know, something very specific. So please bear that in mind if you're going to send information over to Roger. He meets with the brokers regularly and, you know, does his best, and the brokers really do their best to try to troubleshoot issues. And so that is my request, but I really just don't want people to forget that program is there for members. I will put in the chat our NET page, non-emergency transportation. And it does say on there that you have to call at least 2 business days before the appointment. But again, there are some exceptions if things are urgent, but not emergency. Something really is emergency, then 911 would be appropriate. And there is on this, it actually says right here, if it is an urgent appointment and you cannot call 2 business days ahead of time, you can still get a ride. The broker will verify the trip is urgent. And there is a link on this page that has the list of all the brokers by town so that people know which broker to call to schedule a ride.
I can send you more specific data, but we did all that, and some of our members are being turned away for GI issues.
Jillian, I'm going to ask you to send the information to my colleague Roger, whose information I'm putting in the chat.
I also think beyond the points that I think one of the challenges too can be that if members are struggling with challenges around transportation, if they're not connected to an agency or connected to an advocacy organization, they aren't necessarily sure how to like lift those issues up along the chain. So that might be something we could think more about in the future. Like, how can we make it easier for members to actually share their concerns outside, like if they're not a MAC member or they're not in a subcommittee or in some other space. So that'd be something to think more about, I think, in the future.
There is, if members have specific complaints, which I know is different than feedback, and I appreciate feedback that is not complaints, but all the brokers do have their own processes for registering complaints. So for example, if like a driver didn't show up, something like that. So members can certainly contact brokers, or anybody really can contact brokers if there's a complaint that they want to file. I mentioned earlier in the chat that there's also all the brokers hold regular external stakeholder meetings. And I don't know too many details about that. I don't know how frequently they hold those meetings. I want to say it's quarterly, but I'm not sure. And I'm not sure what the participant list is, or like the invitee list. But I can follow up with Roger to find out more information about that, if that would be helpful for this group.
I mean, I think it would be helpful. I guess I was thinking though that I don't know how much MaineCare here, like if let's say there's a lot of complaints about a particular broker, about a particular issue across brokers, is there a mechanism for MaineCare? And it sounds like it would have to be requiring those brokers to share that information. So I don't know how, full that would be. But just naming, like, it would be good for MaineCare to have a way to hear what's not working and I know you do periodically like ask for feedback around non-emergency transportation, but I wonder if there might be a more ongoing mechanism so that people have a way to do it in the moment when they're having a hard time.
Yeah, I'll have to just take that back and think about it. Yeah. There is on that same site that I shared, it does say that you can also contact MaineCare member services. Otherwise I'll have to take that back. Thanks, Kathy.
Thank you. Any other questions or thoughts about this particular issue? One other question that someone lifted up is that the CDC, the US CDC, I think, has started to recommend masking in public spaces again. And the question was like, is there a way that this intersects with the work of the MAC? And I think it's most directly the CDC, but we do have a CDC representative, though I don't think they're here today, to the MAC. And wondering too, if there's like any way, I don't remember how this worked back when masking was more prevalent, if there's a way that like MaineCare seeks to help secure the safety of its members by making recommendations to providers around masking or things like that. So just wondering if MaineCare has, and maybe nobody here has the answer to this, but does have any role within masking and would ever be making recommendations to the CDC around that in terms of people's safety, given the widespread spread of multiple challenging respiratory issues at the moment.
So we have not, we don't come up with our own guidelines about masking. We follow what Maine CDC or US CDC have to say. So I guess my high level answer to that is that our role in the last 3 years has been to share that information, but not to devise any of our own rules or policies. I will say that on transportation, back to that topic, since the very beginning of the pandemic, we have put together very robust guidelines for the NET brokers about keeping members safe during transport. Those are internal documents, internal guidance documents from us to the brokers, but we also have available on our website a member version, a member facing version of what do I need to know about staying safe during transport. And we've kept those guidelines up to date. Again, even with those, we're following what federal guidelines have been around safety and transportation, which have also been changing. And so we do our best to keep those up to date according to federal transportation safety guidelines. Jenny, is there anything else you would add?
I don't think so, no.
That's helpful for us to better understand how that type of thing works. Thank you. Well, that's our agenda. Are there any last questions? So just to recap, I think for January, we are going to revisit the conversation around the subcommittee for the provider, a provider focused subcommittee that's separate from the rates subcommittee. And also we'll put some time on the agenda to think a little bit more about goal setting for the MAC and what that could potentially look like in terms of a process. Is there anything else in terms of issues for January that I'm missing? Okay, well, I hope, oh, and just a quick reminder, we do have a snow date in January. So if it turns out that state government is closed on our normal meeting date, then we would have the snow date, which should be on all your calendars. But if for some reason it's not, let me know and we'll make sure you get it. Thank you all.
Kathy, sorry, can I just say one more thing about transportation because I just remembered before we hang up, which is just to the comment or the question you were making about, how does MaineCare find out about performance of the brokers? We have contracts with all the brokers and there are performance metrics and requirements in those contracts, and we get monthly reports from each of the brokers about on a whole slew of performance metrics. So that's at an aggregate level, across all the rides they're providing or all the requests for rides that they're getting. It's not at the individual level, but I did just want to say that and share that so that the group knows that we do have a pretty strong monitoring system in place for monitoring the performance of the brokers through contractual requirements. And then we also, as you mentioned, Kathy, over the last number of years, we've been doing a lot on evaluating the transportation system, and we have definitely made changes to our contracts to based on feedback that we received from many different stakeholders during that process. So to make the contracts better, to better serve the needs of the people getting rides, as well as the department and our ability to track the performance of those rides. So just wanted to throw those 2 points out there.
And in addition, CMS reviews the broker contracts annually to make sure that they're in compliance. So there are a lot of requirements that are in there and they are revisited often.
Okay, now we can end the meeting. Thanks for letting me say that. And Jenny.
Thank you all. I hope you have a wonderful month and see you in the new year. Have a great day.
Thank you, Kathy.
Bye.
Bye.